let's get on to our topic. So we're talking about knee pain. Let's start with all the different causes of joint pain. I know majority of you have knee osteoarthritis, but let's not forget that there's also other things that can cause joint pain. And there's a whole list of them, including rheumatologic conditions, right, like rheumatoid arthritis, lupus, any genetic conditions that makes your joints lax, connective tissue disease. There's other illnesses like gout or pseudo gout that can also cause knee pain. Some vascular disorders, diabetes, mind you, causes actually joint pain and other nerve conditions, some blood disorder and some nerve disorders. So when you see us for the initial evaluation, we make sure that we rule out all these other things before we provide the treatment for your osteoarthritis. We want to make sure there's no other coexisting condition that can add to your pain and treat that accordingly. So osteoarthritis, our topic for today, it's a chronic inflammatory condition wherein it creates wearing out or degeneration of this cartilage that's protecting your joints. And over time, as the cartilage wears out, the space in your joint decreases. There's less volume of that fluid that cushions your joint. And then the other lining, which is the synovium and the capsule, also starts to become worn out and strained. And then for worst conditions, the bone underneath the cartilage actually starts to get bruised up and starts to get degraded too. So those are what we call level 4 osteoarthritis, which is the severe kind of arthritis. And there's a genetic component to it, but majority of the time it is from chronic years of wear and tear, overloading, improper biomechanics, and just, it's like a tire, we wear out our joints and over time it just kind of gives out on us. So there's this imbalance of abnormal cells and normal cells in your joint. And that's what we're gonna discuss that later on, how the cells actually creates a homeostasis or balance of this good cells versus the bad cells. You're familiar with the meniscus. It's also a cushioning that helps the cartilage in protecting your joint. And the meniscus is that thickened cartilage that's a cushion, acts as a cushion between your shin bone and your thigh bone. And when your cartilage is worn out, your meniscus gets overloaded. So majority of the times you also see tears in the meniscus when you have arthritis in your joints. A lot of patients come to us saying, oh, I've got a meniscus tear. Is that my problem? I'm hurting in my knee. There are a lot of patients with no knee pain that has meniscus tears. So although they are concomitantly found, a majority of the time it's really the osteoarthritis that's causing your knee pain and not necessarily the degenerative meniscus tear. Other things around your joint that can contribute to pain would be tendinitis, which is inflammation of the tendons, which is the structure that connects your muscle to your bone. There's also bursitis. Bursitis is the inflammation of the bursa, which is that sac that cushions your bone from the soft tissue around it. And the sprain of your ligaments. Ligament is what connects your bone to your bone. And whenever you don't have a good protective cushioning in your joint, all these structures around your joint gets overloaded and overworked. So they become sprained, they become inflamed. So they can cause pain as well. And this is one reason why patients with knee replacement come to us, because they still continue to have knee pain. And that's because they still have all these other concomitant structures that contribute to their pain that can get inflamed even after a knee replacement.